Oh, hey guys, my name's Chris, and I was just going to share I am 9 days post op from rotator cuff, excuse me, rotator cuff repair. I had a small tear in my rotator cuff, so overall, I'm off pain medicine. It was really not, I mean, I was on pain meds for maybe 3 or 4 or 5 days ish. Sleeping's really not been that bad. Um, the sling is a pain to have to wear. And I mean, essentially, I can't use my entire left arm. But overall, again, I had a couple anchors put in, one or two. I'm not sure. I'm going to see my surgeon on Tuesday in a couple days. But overall, it was not really bad procedure. I've had a lot of other orthopedic surgery. Like this is my 14th surgery for orthopedic, and this was like not bad. Like, so I had they cleaned out my shoulder is what he said also, so I don't really know what that means, but I had a bone spur removed on my other shoulder, and that hurt like a you know what. They like shaved it off, so that hurt a lot. And this, like, my pain level is very low, so I'm just gonna keep following what they're telling me to do. I'm allowed to like extend my elbow, and that's about it. Take it out of the sling, just extend it. I'm not allowed to pick anything up, lift my arm. After 3 days, I was allowed to get in the shower, and I could let water run over it. But I'm not supposed to submerge my shoulder for like a month underwater. So I go back to the doctor in a couple days, but overall, small. It was torn and it was hurting. I mean, it would hurt lifting weights, and then it would also hurt going to sleep at night sometimes. So that's why I went ahead and had it done. I had like tendinosis, and then a small tear. So if you're thinking about doing it, I think the worst part about doing it is actually doing the recovery, because you cannot, I mean, I cannot use my arm. So there's like nothing I can do. I can maybe hold my phone, and maybe barely type on a computer. But other than that, like, might as well just pretend your arm's not there. But again, I know mine was pretty minor. It was just tendon repair, cleaned it out. Pain, not much. It's just, again, the sling is a lot. So, anyways, guys, I just want to share my experience. Overall, it's been pretty easy. Procedure was like 2 hours. They gave me like anesthesia in my neck or something, and made my arm numb for like 20 hours. And then come off the anesthesia, got on the pain meds, then got on some Tylenol. But I mean, overall, I mean, I flushed the rest of it down the toilet. So, it's really not that bad of surgery. Now, my friend had a whole bunch of stuff done with, he had like 4 different things done to his shoulder, and he said it was brutal. So, if you're just getting a tendon repair for rotator cuff and you're not, having like all kinds of other stuff, it's really not that bad. So, you know, I'm just trying to share information so you can hear my experience. So good luck with your surgery or whatever you choose. I mean, I tried one shot too. I tried a cortisone shot, and it lasted like 25 days, and it was like, masking the pain. And then I also read that rotator cuff injection. After, of course, after I got the injection, I read some stuff that said that it can deteriorate the tissue if you do too many of them. So I don't know, but I had 2 surgeons like telling me to do the shot, and so finally I did it. And I mean, it's like, well, it's torn, it's not gonna like fill the gap. So to me, it didn't make any sense. So I don't know. I think the big reason they don't want you to do it, or they're trying to keep people from doing it, is because, I mean, I can't do anything until my shoulder heals. Like, I pretty much cannot use my arm, and I think that's the big reason they were discouraging me from doing that. But not discouraging. They weren't telling me no, but they were trying to like lean towards, maintenance, or trying different activities, or rubber bands, and strengthen the rotator cuff, or but it's like, well, man, it's torn. It's a full tear. Um, so the first time I went to see him, I don't think it was a full tear, but then about a year later, uh, I just continued exercising. But I mean, it hurt. Like on the bench press, like I mean, it hurt. Like it hurt to push like really lightweight. So I'm excited to see the outcome. I'm just gonna follow the physical therapist and see what they say. So that's all I got, guys. Good luck to you.